Hi, this is Megan from Step Up for Mental Health. I will be taking over this podcast for the next few weeks. To address the various social justice issues that are embedded within American society, I want to take some time to recognize how the field of mental health contributes to the injustices against marginalized communities. Specifically, how it can serve and excuse the prison industrial complex in ways we do not expect. In the next few weeks, we will take time to address social justice issues that pertain to the field of mental health, as well as ways we can advocate for change that will benefit the communities who are disproportionately targeted by the criminal justice system and largely neglected by the field of mental health. Today on Mental Talk, Step Up for Change, I will be discussing the commonly believed narrative that deinstitutionalization of mental health hospitals led to the rise of mental illness within homelessness in the prison system. I will be referring to the work of Ben Moshe, author of Why Prisons Are Not the New Asylum, to help disprove this myth by offering alternative explanations to the prevalence of mental illness within homelessness and incarceration, and view this problem as a socio-economic and political problem rather than an individual issue. To start off this discussion, I want to place a trigger warning that this podcast will be focusing on mental health topics such as mental illness or self-harm, as well as discussing topics involving homelessness and incarceration. Let's start by addressing how effortless it is for us to blindly believe the statement that deinstitutionalization of mental hospitals contributed to the rise of mental illness within homelessness and prisons. Dr. Ben Moshe labeled this narrative as the new asylum thesis, and this thesis claims that, quote, deinstitutionalization failed and led people to be homeless and funneled into the criminal justice system, and therefore the only way to correct it is to reinstate psychiatric hospitals, end quote. These claims from the new asylum thesis are using deinstitutionalization as a scapegoat for the high prevalence of mental illness within homelessness and incarceration. By using deinstitutionalization, the narrative shifts the attention away from the violent, isolating environments of prisons and homelessness that create or worsen mental health problems, and instead place the attention on incarcerated and unsheltered people for being mentally ill. Later on in this podcast, we will discuss alternative explanations of mental illness prevalence within the environments of prisons and homelessness. I plan to explain problems that are pointed out by Ben Moshe in her article, and I do not support deinstitutionalization as the cause of increased mental health problems in either environment. Firstly, I want to touch on why deinstitutionalization is being scapegoated. Before the closure of mental hospitals, individuals whose mental state went against societal norms were being taken out of the public and considered no longer to be a threat to the community due to their mental health. In fact, people who were often institutionalized were erased from society altogether and made invisible due to their institutionalization, creating this out of sight, out of mind mentality towards mental health. Additionally, these facilities did not provide excellent care and treatment of patients. It served as a facility to place unwanted people who had been labeled as deviant or a threat to society, people in quote unquote need of social control. Now, all this information is important to know in reference to the new asylum thesis, but I want to take a deeper look at the relationship deinstitutionalization has with homelessness and incarceration. The misconception deinstitutionalization has with homelessness claims that the closure of mental hospitals led to abandoning people, specifically mentally ill individuals, to continue to live their lives on the street or to be incarcerated. And I think an important message to talk about first, which is actually something Ben Moshe discussed in her article, is how mental illness is a social construction based on social norms. Again, we can see how mental health is encapsulated within social control initiatives, labeling those with differences in their behavior and reactions to various events and stimulations as being mentally ill. The new asylum thesis is looking at homelessness as an individual problem rather than what it is, a socio-economic issue. However, the behavior unsheltered people demonstrate as a means of survival can often be mistaken and defined as the behavior of someone with a mental illness. as it deviates from social norms. Instead, we choose to label this problem as mental illness instead of recognizing the ways the state has created an environment that festers adverse experiences and poor mental well-being. Ben Moshe argues that mental illness is, in nature, a political and socio-economic problem created by the state, scapegoated by deinstitutionalization. Living in an environment that is constantly noisy, lacks privacy, is anxiety-inducing, and has exposure and vulnerability to violence or attacks, as well as the threat of being removed or arrested, and not to mention how these people often experience dehumanization from the general public, are all ways that homelessness is disabling to a person physically and mentally. So why are we not perceiving this problem as an issue that the environment people are experiencing while homeless promote and intensify poor mental well-being? Instead, we are looking at victims of housing insecurity and those who lack proper resources as the culprits of their own homelessness. This is where deinstitutionalization comes to play. It disguises the true reason behind the increased levels of mental illness within homelessness and shifts the blame towards the individual because they are not institutionalized and therefore pose a threat to the community. Not only is this disabling environment left out of this discussion of deinstitutionalization, but is also oblivious to the timing differences between the end of mental hospitals and the start of housing insecurity. If we take a look at deinstitutionalization, it began and started in the 50s, continued through the 60s, and the majority of institutions were closed by 1970. However, when looking at housing insecurity and homelessness increases, we see it during the 80s, throughout the 80s, as a matter of fact. So suggesting that those who were previously institutionalized at hospitals are now the same people winding up on the streets is being ignorant to the timing difference between the end of hospitalizations and institutions and the beginning of the housing security. Additionally, the people who were being affected by homelessness and those who were institutionalized in hospitals are not the same populations. Those impacted by home loss were often families with small children, and those being released from institutions were typically individuals who were left on their own by their families. However, this narrative that deinstitutionalization is the reason behind the increased mental illness within homelessness is really supported by empirical literature that aided in the shift of the narrative away from the responsibilities of the government, who created such housing insecurity, and shifted the blame towards the victims of housing insecurity due to their quote-unquote mental illness. This totally emphasizes how the power of research is able to change social beliefs depending on the lens that it decides to take. This is also the same time where we're seeing the medicalization of homelessness, viewing it as a problem with homeless people, then again as a problem of housing or a socio-economic political issue. We've come full circle to this medicalized explanation to go back and blame deinstitutionalization for mentally ill individuals as the reason that homelessness is associated with mental illness in the first place. And as a result, we are seeing solutions being proposed as a way to address deinstitutionalization as the problem and not housing insecurity. We see more therapeutic interventions for homeless people, which can be a great resource when they are not serving to treat inequality and injustices. Therapy for those experiencing homelessness is merely trying to teach people how to cope with societal injustices and violence. And on top of that, solutions are being proposed to bring back mental health facilities, mandatory institutions for mentally ill individuals. One final note in this section focusing on the link between deinstitutionalization and homelessness is that the Reagan administration imposed a $30 billion decrease in housing assistance and tightened the eligibility requirement. The closure of mental hospitals was supposed to save costs that were then going to be reinvested in supporting community mental health centers, which never happened. Housing insecurity is an issue far more complex than the closure of mental institutions. Neoliberal politics, beginning with the Reagan administration, has transformed housing insecurity as a form of state violence against marginalized communities and merely dismissed it as a problem regarding deinstitutionalization. This transition between homelessness and incarceration on the topic of deinstitutionalization is best exemplified by Louis Lacan's work in Punishing the Poor, which explains how individuals and communities have been deemed dangerous or deviant. First, we see it in socialization, with education from social norms. Rather, it's more of a mental difference between individuals. Additionally, we can see medicalization playing a role in defining the problem as an issue that needs to be treated, again labeling mental health problems in homelessness and incarceration as a medical problem rather than a socio-economic issue. And finally, we see how then these individuals are being targeted and penalized. This is where incarceration plays the biggest role in social control. The idea that state officials are allowed to remove unsheltered people out of public spaces in order to strengthen the connection and socialization between danger and mental illness, and support the notion that these people are deviant. On top of this, we can see how states and cities are further criminalizing behaviors that are deeply associated with homelessness and survival, such as sleeping on park benches or public places asking for food or money. Rather than taking the time to invest in housing and to help those who are unsheltered, the state is putting more funds and effort into criminalizing the actions of homeless people. And it's clear to see all the criminalization of homeless individuals are strongly associated and correlated with incarceration, regardless of mental health or deinstitutionalization. And to look at conflicting evidence again between deinstitutionalization and the incarceration growth. Unlike housing insecurity, we do see a similar timeline between the two events. However, during the 60s, when neoliberal politics were cutting public services and continuing to close mental hospitals, the carceral state grew immensely. While we do see this overlap between the closure of hospitals and the growth of the prison population, it's important to once again look at who was being released from institutions and who is newly being targeted by the carceral state. Those who were being released from hospitals tended to be older white individuals. And there was a relatively equal balance between men and women who were institutionalized. However, for incarceration, the prison system has and continues to disproportionately target young men of color. It's important to acknowledge now the recent rise in the past few decades of women of color being incarcerated at the hands of the state. Nevertheless, though, these are not the same populations that were being released from mental hospitals. And yet again, similar to the environment homeless people experience, those who have been and are incarcerated are placed in another environment that promotes disabling the physical and mental well-being of people. Conditions of confinement are contributors, if not a major reason for poor mental health in prisons. And I want to give a quick content warning for this next portion, as I will be talking about self-harm and suicide. In research, studies looked at personal characteristics as a way to individualize and medicalize the problem of suicides within prisons, rather than evaluating environmental conditions of prisons themselves. Yet again, we can see how research and empirical literature are promoting and scapegoating individuals rather than addressing the overall socioeconomic and political problem within these facilities. Additionally, these research and findings result in weak suicide prevention policies that do little to improve the problem at hand, to address suicide within prisons. Instead, they should be examining prison conditions to get a better, more holistic understanding of why suicide rates are so high for incarcerated individuals. The nature of incarceration is distressing and deteriorates mental and physical well-being. In some cases, individuals who are being taken into prison are given an additional label of mentally ill, gay or queer, gender nonconforming, and so on. These individuals are then placed into administrative segregation or protective custody in order to, quote unquote, protect them. However, segregation is isolating and typically does very little to protect these individuals. Instead, it helps to identify vulnerable populations for prison staff to exploit, brutalize, and abuse these people who have been incarcerated. So we can see how segregation can also cause and exacerbate mental health problems and physical health issues, regardless of the individual's prior mental health state before incarceration. And now I just want to give some closing remarks and bring everything we've talked about into a final thought. People are unsheltered not because they need to be institutionalized, but rather due to economic inequalities, including, but not limited to, the lack of affordable housing, cuts in public service, erosion of livable wages, and other policies that are disproportionately targeting marginalized communities. Blaming deinstitutionalization diverts attention away from the violence people are experiencing at the hands of the state, and then places the blame on those who are being victimized by such twisted policies. Finally, I want to recognize the work of Dr. Ben-Moshe once again, as her work was foundational to the discussion we had today. There are many articles and studies involving the misconception that prevalence of mental illness and homelessness in the prison system stems from deinstitutionalization. I encourage everyone to continue reading up and learning more about this narrative and how to combat this misconception. Next week, we will further explore how prison conditions, environments, and isolation contribute to mental health problems for incarcerated people, and how it can be deteriorating to all forms of health. Thanks for listening, and I'll talk to you again soon.